All right, so let's move on from the pelvic girdle and now talk about the femur, your big thigh bone, right? And again, this is for your reference, and I'll break down the landmarks I definitely want you to know. So this isn't a left and right. This is actually showing a right femur. It's just showing you the front, the anterior, and the posterior. And what we have here is a femoral head. Hey, it sounds like another bone, right? And then you have a neck. And compared to like the neck of a humerus, you see that the neck of the femur is much more prominent, much more distinguishable, and easy to see. And then you have this, but instead of having tubercles like your arm bone, your humerus, you have the greater trochanter instead of tubercles. And then you also have the lesser trochanter. So even like you have a greater tubercle and a lesser tubercle, you have a greater trochanter and a lesser trochanter in the femur. And the trochanters are, at least in humans, specific to the femur. So if there's a trochanter, it's a femur. So remember that the head and neck leads to the shaft of a long bone, and this is the front surface. But on the back surface, you have this ridge, and actually, a lot of people, and this is a tough thing about teaching this class online, is that you don't really get to see real bones. But some people have very prominent linea aspera. So this is a small ridge right here, actually. So it's kind of hard to see, but there is a ridge. And why is there a line? Well, remember when there's some sort of projection, bump, or something that pokes out, something attaches to it typically, or it fits somewhere. In this case, it's attaching many of these muscles that are in your upper leg. They actually attach to this linea aspera. And then you have the patella surface and the popliteal surface. Hey, remember that all the anatomical landmarks in chapter 1? So this is where they come in handy again. So patella, again, another name for your kneecap, or the medical term for your kneecap. And popliteal is the back of your knee, right? So the patella surface, that's where your patella fits on, and the popliteus is where the back of your knee or the crook of your knee is. All right, so one thing we see here, just like the distal portion of the humerus, on the distal portion of the femur, you have things called condyles. So the ones that are toward the midline are called medial condyles, and what's the opposite of medial? We have lateral. And just like the humerus, what do you have above and outer? Remember that prefix epi can mean outer, but can also mean above. So kind of not so relative to condyles, which are distal. Over here, we also have other bumps as well, and these are called epicondyles. And again, they follow that direction. That's why lateral and medial are very important directions to know when you're talking about the appendiculars or just appendicular anatomy in general. All right, so common question. So what if I just showed you one of these bones and asked you which one is? How do you know which one is the humerus? How do you know which one is the femur? There's multiple ways to do it, but when I'm looking at a humerus and femur, what are my go-to signs that I look for first? Well, one, I look at the head and neck. So remember that humerus has a very thick anatomical neck compared to the femur. So the femur, you can see the neck is pretty distinguishable, and the humerus has a very thick neck. There's a slight indentation, but it's not as clear-cut as the femur. So I look at the neck. Is it very clear? Or is it kind of fused together with the head? If it's fused, it's a humerus. If it's pretty distinguishable, it's probably a femur. And then I remember that the humerus has two necks as well. So you have an anatomical neck, but it has a surgical neck. And remember that surgical neck is the one neck that's more likely to be broken than the anatomical neck. So again, the humerus has two necks, and the surgical neck is the anatomical neck. And then instead of these small bumps, these tuberosities in the humerus, you have the much bigger trochanters in the femur. So that's another dead giveaway. And then what do you see here? Well, you have condyles outlined here. But compare the condyles, like remember you have the trochlea and the capitulum in the humerus, and then you have condyles in the femur, the lateral and medial condyle. But look at them. Notice that the trochlea doesn't look very similar to the capitulum, but the lateral and medial condyles are pretty similar in the femur. So I look like, okay, are the condyles kind of symmetrical and kind of like do they look proportionate, or are they distinguishably different in appearance? If they're different, it's probably a humerus. If they're very similar, it's probably a femur. So there are more ways and more things like the linear aspera and other things you can look at, but this is what I look for when I try to identify a humerus versus a femur. All right, so then right below so a little more distal, or at the distal end of the femur, you have the kneecap, you have the patella. And what do you notice about the anterior and posterior view? Does it have the same texture? Well, notice that the anterior view, you notice that this surface of the front surface of a patella is rougher, whereas the posterior view, you notice that it's smoother. And why is that? Well, remember, the patella is in front of the femur, right? So if it's in front of the femur, you want the back of the patella to be smooth so that when it's moving around against the femur and the tibia and the tibia as well, you want it to be smooth because you want it to glide. Whereas the anterior view, the one that's more up front, well, remember my rock climbing analogy, which is easier to climb on, a very smooth surface or a very rough surface. So by having a rough surface on the anterior view, that enables other things to connect and grab onto. So it causes more friction and more grip on that surface. So we have the patellar tendon that runs across that patella, the anterior part, and that helps, or patellar tendon or ligament, depending on who you ask. Same structure, I don't care. But so then the whole point is that you have a tendon that runs across this that helps with the rough surface of the anterior of the patella, helps to kind of anchor it, and also helps in the pulley and the overall mechanics of the knee joint. Okay, so then we have our right femur and patella. So again, the back side, the posterior is smooth, you want it to glide, whereas the front side, this is rough because you want those tendons and ligaments to attach to it. Now, going further down, now we're at the tibia and fibula. Again, this is a common mistake, fibia and tibula. No such things. Tibia and fibula, again, they sound very similar, but they are different. So what we have here is that you notice that the tibia and fibula are also not very look at their overall thickness. The tibia is thicker, the fibula is thinner. So another mnemonic, how do I determine the two? The tibia is thick. I like to think of that. Tibia is thick. And I learned this from a past student. The fibula is thin. So think of like you're saying thin with the further list. So you're saying that the fibula is thin. All right, so look at this medial and lateral malleolus. So even though the fibula is very skinny, notice that, is it just like a bone that's just there? Well, it also forms a very important thing called the lateral malleolus. And the medial malleolus on tibia and the lateral one, it works together to kind of help anchor the ankle joint. So as here we have the talus of your foot. And this is what allows it allows a little like lateral stability to the overall ankle joint of your foot. Now, a common question, what if I just show you a picture of the radius and ulna or tibia versus fibula? How do you tell those two apart? Well, they both have an interosseous membrane, and there are two bones that form the distal part of your limbs. But how do you tell them apart? Well, this is what I look for first. So notice that the radius and ulna, they're not symmetrical, but in terms of their overall thickness, notice that the thickness of the radius is pretty similar to the thickness of the ulna. Whereas the tibial thickness, tibia is always way thicker than the fibula, unless it's a very rare anatomy. But in general, you have a much more disproportionate thickness between the tibia and fibula than you have between the radius and ulna. And then again, dead giveaway, that trochlear notch with the ulna. So again, if you see that, that's my go-to. If I see that scoop, that notch right there, I'm like, that's an ulna. That's what I look for first. And the radius, I also look at the head as well. If I see the head is round like a circle, remember a radius, that point from the inside of a circle to the circumference, or inside to the outside. That's the radius. So that's why my dead giveaways. I look at the head, or I look at this part of the proximal part of the bone. Now, tibia and fibula, they do not have the scoop. They do not have this circle. So I also look at this as well. So notice that the tibia, again, the radius does not have the same, or like the tibia will not have a round head. It won't have that styloid process as well. Okay, so that's what I look for when I'm determining radius and ulna versus tibia and fibula. Now let's do a little review. Okay, so again, if you can't see this part right here, you can click the picture and it'll zoom in on it, and then you can click it again to close it. It also works on your exams as well. So a little review. Identify the type of bones that are highlighted in red here and marked with the star. So we're talking about the bone group in general. What are they collectively referred to as? Okay, let's see how everyone did. So most of you said carpals, and most of you are correct. Again, your wrist bones are collectively known as the carpals. We're looking at the hand right now. Next question. So identify the type of bones highlighted in yellow and marked with a star. Okay, let's see how everybody did. All right, so most of you said metacarpals, and most of you are correct. Again, we're not talking about the proximal phalanges. They're not directly connected to your carpals. You have the metacarpals that are meeting the carpals and the proximal phalanges. So it looks like a lot of you are on the right track. And again, if you didn't get correct, at least you have all the time to get it correct, and now you know the right answer before you actually have it on the exams. So why do I bring this up? I bring this up because, again, remember proximal and distal, also very important when you're talking about the appendicular skeleton. So you have your carpals, your wrist bones, and then your metacarpals that are meeting your carpals and your proximal phalanges. So again, their proximal phalanges you can actually feel, right? Because, or actually are visible relatively, because again, these are the parts that form your fingers, right? So the phalanges form your digits, and your proximal, middle, and your distal phalanges. Why is this useful? Well, very similar in, remember your fingers are called digits, and so are your toes. Well, the finger and toe, or your finger bones and your toe bones, they're also called phalanges as well. So again, proximal and distal are also very important. Remember, distal often distance away from the center part of your body, and then proximal closer. So you have proximal phalanges, you have middle phalanges, and you have distal phalanges. And that's what we have here. Again, proximal closer towards the body, distal away. And even though they're relatively squashed compared to your finger phalanges, they're still phalanges. And then you have the hallux, the big toe. And notice that compared to having 3 small bones in each toe, the hallux, the big toe, only has 2. Therefore, there is no middle phalanx. There's just a proximal phalanx and the distal phalanx. And then you have the tarsals. So instead of carpals, you have the ankle bones, or the ankle and heel bones, the tarsals. And then you have the metatarsals. So just like you have the carpals in your wrist, you have the tarsals in your foot, but you have the metatarsals, just like you have the metacarpals in your hand, you have the metatarsals in your foot. And this joins the phalanges to the tarsal bones. And again, just like how you count from 1 to 5, starting with your thumb and going all the way to your little finger on the right here, or depending on which finger, but again, you start with the big one and you work your way to the very small one, the littlest one. So that's how you go 1, 2, 3, 4, 5. Same with your toes. You go from the big toe, go to your little toe, 1, 2, 3, 4, 5. All right, so it's kind of hard to see here, but there are compared to your carpal bones, 8 carpal bones, but only 7 carpal or tarsal bones. So 8 in the wrist, 7 in the foot. So in terms of tarsal bones. So we have the talus. So this kind of forms your ankle right there, and then the calcaneus, this forms the heel of your foot. So you see the calcaneus, if you're looking at it from the side, this is the part that's actually touching the ground. The talus, that's where the tibia and the fibula are articulating with. So this is the part that have the malleoli that are on either side. And then the talus, again, that forms your ankle joint. And then you have something called the navicular. So it's hard to see from here, but the reason why they call it sounds like navigate, right? So they say this part is kind of scooped out like a boat. So they say it looks like a boat. And then these 3 right here, they have the same name above, and then, let's go to this. So this is the cuboid. And cuboid, when you think of a cube, you think of this. And you're like, at least that's what I think of the cube. And I'm like, does that look like a cube to you? Yeah, I don't know. It's like, I think they're just trying to come up with names at that point. And then we have this. We have the medial cuneiform, the lateral cuneiform, and depending on the textbook, they're pretty much the same to me. Intermediate or sometimes middle cuneiform. So what is that cuneiform? Well, it was that, if you've taken that world history class, you've probably heard about the Sumerians and their writing system. And I'm like, okay, so this is cuneiform. They say it's wedge shape, and I'm like looking at it, I'm like, yeah, does that look like this to you? Yeah, when I look at him, like, I don't get it either. So I'm like, whatever, like, we don't get that. Who are there even Sumerians right now? So come on, it's like, but that's what we have to work with. That's what we have to do with. So again, I mean, to me, frankly, the navicular cuboid cuneiforms, they all look like little rocks, but that's what we have to work with. So again, when I have something frustrating like that, I just go with mnemonics. And this is my favorite mnemonic. Why? So it tells you the first letter. So you have the calcaneus, you have the talus, you have the navicular, then you have the medial, and this is why I go with intermediate, because otherwise this mnemonic doesn't work. Intermediate, lateral, and then the cuboid. But what I also like about this mnemonic is not only that it gives you the first letter, it has a pattern. I don't like the mnemonics that bump all over the place. This one also kind of has a C sort of shape, so it kind of boomerangs. It goes in order. So this is the one I look. But the other thing about mnemonics is that you also have to orient yourself. This is the right foot. It won't have the same order if you're looking at it from the side or below, or if you're looking at the left foot. So again, you have to kind of orient yourself and make sure you're using when you memorize the mnemonic, you have to know which way you're looking at the structure. And then when you're taking a test, you have to see, like, okay, is this the same way I memorized it, or is it a different way? Do I have to flip everything around? And this is the medial foot view of the right foot. And what we see here is like the arches, and this is pretty much what I wanted to get from this. There's the arch that we typically associate with the arch of our foot, but there's also a transverse arch that goes across our foot.